The Patient and Whānau Centred Care program is part of our triple aim in the organisation. Now, the triple aim is about improving the patient's experience, it's about looking at the costs and affordability, and it's also about our population needs. So you can see that the impact of this developing our patient and whānau centred care strikes right at the heart of our triple aim. In this organisation we've used patient stories to help improve quality. So we've taken the learnings from patient stories and developed projects, working groups. One of the benefits coming forward now will be hearing positive patient stories.
Most of the patients that I've talked to about having their whānau around, they've been very appreciative. They've felt more settled, and as I say, often it's in that first few hours, the first day, where it's an unfamiliar setting, they're not sure what's happening, they're a little bit scared that comes through, and that they're most in need of support.
On balance, we find that open visiting to be, and with families staying, really positive, but we do have strict guidelines and expectations which we set out at the beginning. We work in partnership with the family and we develop a good rapport with them. So we keep that communication going through all the time, and we actively work out looking at where there are any barriers to discharge and things like that. So we can actually reduce our length of stay by having family involvement at the beginning. The family participate in cares, and the nurses, it gives them an opportunity to teach them cares, particularly if they're going home and these carers are going to be the main caregivers at home. So we got that opportunity to teach them. It's not compulsory, they don't have to participate in the care, and a lot of them choose not to, but there are many that do. As a result, we have less complaints because the family are actively involved in all aspects of the patient's care and decision making.
Evidence shows that organisations that invest in developing and working with patients and families have a major return on their investment.
We needed to identify a way in which improved the way face-to-face experiences occurred for Māori patients initially, and it was around the first contact that was our starting point. But we realised that as we got into this a bit more, that by developing a tool that standardised the 6 principles of engagement, that all people would benefit from it, not just Māori patients. Because partnership is what we're going to be achieving. Partnership is what we're going to be achieving, but we're protecting the human rights, we're honouring and respecting it, we're increasing participation, and with increased participation, that's the model of partnership that we actually seek. Well, AIDIT itself is a communication tool that standardises 6 principles of engagement: acknowledgement, introduction, identification, duration, explanation, and thank you. We've actually trained around 3,500 staff since we've started. What difference it makes is that patients are now saying they know who is talking to them. Well, I hope that's what they're saying, because that's exactly, some of the data show that they know who they're talking to, they know why they're there, and they know who, they actually just feel more part of what's happening.
Some areas need to be convinced of the benefits. Some areas have taken this on as part of normal practice, and so they can see the benefits, they just want some help.
The main concerns raised were that we would be inundated with visitors, that ward rounds and the primary activities that sort of happen in the morning would be interrupted by family and whānau. Also the concern that they would all want to stay overnight. The reality is that yes, we have more visitors now in the morning, but those visitors tend to be with their family. So the patient and their family are together, they don't tend to crowd the wards. And overnight there are very few people that have actually chosen to stay. When they want to, they're allowed to, but the concerns of staff with regards to overcrowding and the increased work of having family there just really haven't happened.
In order for this program to be successful, we have to have everyone on board. It's not just our patients and families, but that's staff. This program makes so much sense. We need your help, and I would encourage you all to partake in this really exciting part of history for counties.